Welcome to Med-Surg Mini number 25 on cystic fibrosis. This is an autosomal recessive disorder that causes alterations in the CFTR gene. This gene often produces proteins, cystic fibrosis transmembrane conductance regulator, and this protein alters the extracellular ion concentration by inhibiting sodium transport channels. When the sodium is unable to properly transport, it builds up on the outside of the cells and causes the water inside of the cells to osmose to the extracellular area, trying to dilute some of that sodium buildup. This causes a buildup of mucus on cells, which further inhibits cell transport and functioning. This mucus buildup also occurs on many of the glands, including the lungs, sweat glands, pancreas, liver, salivary glands, and reproductive organs, causing dysfunction in those areas. It is most common in Caucasians, and we do see equal incidence for both men and women. About 10 million Americans are carriers for this disorder, and the life expectancy of somebody with cystic fibrosis is about the mid-30s. Symptoms would include failure of any affected organs, shortness of breath, tachypnea, irregular bleeding, muscle retractions, pursed lip breathing, nasal flaring, diaphoresis, and the diaphoresis often has a salty concentration to it, use of accessory muscles, wheezing, lung infections, nasal inflammation, constipation, growth impairment, statorrhea, which is a foul smelling and greasy stool, and a productive cough. Diagnosis would include genetic testing, increased chloride levels, and a sweat chloride test, which would show concentrations greater than 60 milliequivalents per liter. Non-pharmacological management would include caloric supplements, chest physiotherapy, and postural drainage techniques. Pharmacologically, we can provide them with bronchodilators, mucomist, hypertonic saline nebulizers, anti-inflammatory medications, antibiotics, fat-soluble vitamins and pancreatic enzymes, and CFTR modulators, which is a newer form of treatment. If an individual needs it, we could also provide a lung transplant or a pancreas transplant. However, this will not cure the disorder, it just prolongs life. Some complications would be development of diabetes, especially if the disorder is affecting their pancreas, respiratory failure, infertility, especially in males, chronic respiratory infections, mostly from staph, influenza, and Pseudomonas. And main nursing problems would be ineffective airway clearance, social isolation, impaired gas exchange, fatigue, risk for infection, and nutrition deficits. Education we could provide would be education on genetic screening and counseling, grief support as they adjust to their new ways of life, medication education, airway clearance techniques, nutrition, and infection prevention techniques, including vaccinations. And that wraps up our discussion on cystic fibrosis.